Hello, in this video I'm going to be talking about estrogen levels after stopping endocrine therapy. We've been asked by many of you who are watching our videos in the comments section, you've asked, won't estrogen just come roaring back? So let's go through that. Before I go on though, I do want to invite you to subscribe to our channel. We're always putting out new content. And as with this video, it's often in response to questions that you've offered. So keep those questions coming. So let's talk briefly about how endocrine therapy works, how it changes estrogen levels, if at all, and what happens when you stop the endocrine therapy. I want to start with aromatase inhibitors. Aromatase inhibitors block the enzyme that makes estrogen in tissues of the body other than the ovaries. I'll say that again in a different way. After our ovaries stop working for people with ovaries, we still have estrogen in the body. It's made by tissues like adipose tissue, fat, and made by the adrenal glands, also made by other tissues in the body, but those are the two main sources. An enzyme called aromatase converts androgens, what we think of typically as male sex hormones, to estrogen. And by blocking that enzyme, we can't convert into estrogen its precursor hormones. When you take an aromatase inhibitor, if you're a candidate for an aromatase inhibitor, the estrogen in your body made by non-ovarian tissues will be shut down. When you come off the aromatase inhibitor, yes, your estrogen levels will come back up to what they would have been without the aromatase inhibitor. They don't rebound, they don't go way back up. And it's been shown that 5 years out of an aromatase inhibitor, or 10 years if you have higher risk disease and are tolerating the medication okay, that is sufficient in people without advanced disease. So let's say you've had surgery, you had low, moderate, or high-risk disease, and you're put on an aromatase inhibitor. The suppression of the aromatase in your body, the suppression of estrogen, lasts even beyond, and the benefit lasts beyond when you stop the medication. So you don't need to be on it longer. 5 to 10 years is sufficient. And while your estrogen level will go back up, staying on an aromatase inhibitor beyond that recommended 5 to 10 years, again, depending on your risk, doesn't give you any added benefit. We have a video about when to expect side effects from the aromatase inhibitor to resolve, and we'll link that here. What about tamoxifen? Tamoxifen is really interesting. It does not lower your estrogen levels. Your estrogen levels actually, if you have ovaries, can go up when you're on tamoxifen because the ovaries start making more estrogen. When you're on tamoxifen, tamoxifen blocks the estrogen receptors of breast cancer cells. So you can make as much estrogen as you want, and the cells don't see your body's estrogen because tamoxifen is occupying the receptor or the seat where estrogen would have fit. When you stop tamoxifen, your estrogen levels will go back to what they would have been without tamoxifen. And we know that 5 years in many people and no more than 10 years in people at higher risk is sufficient to give you that benefit. And as we followed in other videos, we've tracked the benefits of more than 10 years. It appears that all you do after 10 years is pick up the adverse effects, not additional benefit. Cancer cells, if they don't divide, they eventually die. Blocking estrogen is a really powerful way, either by lowering its production or not letting it get to cancer cells, to improve disease-free and overall survival. What about ovarian suppression? So for people who are candidates and recommended to have chemotherapy and decide not to, they are often offered ovarian suppression and either tamoxifen or an aromatase inhibitor. In addition, people who do receive chemotherapy with higher risk disease, who keep menstruating, whose ovaries keep working after chemotherapy, those folks are also offered ovarian suppression along with oral endocrine therapy. What happens when you stop ovarian suppression? What will happen to your estrogen levels? Suppressing the ovaries with an LHRH analog, ovarian suppression injections, people who are on those medications can see their symptoms from ovarian suppression resolving in a couple of months. Your periods may not go back to normal because time has passed, and if you were in your 40s, perhaps they won't come back. But your ovaries are still working. This is important for a couple of reasons. One is you will start to get the benefits of having physiologic levels of estrogen in your body. The other reason it's important is because it's very likely that you may conceive and you don't want to become pregnant when you're on tamoxifen. I covered a lot in this video. I hope it's helpful. Drop a comment or a question below. I also want to invite you to go to yerbba.com to get your personalized Yerbba report. There you can learn about the optimal duration of endocrine therapy and which options might be available to you. Thank you as always for watching, and we'll see you next time.